Campaigning, residents of South London found out the fate of services at Lewisham Hospital this morning. The Health Secretary, Jeremy Hunt, told the House of Commons that whilst he understood the concerns of local people, he had taken advice that the future of health services in the area as a whole would be better if the A&E department at Lewisham was downgraded. He explained why he felt he had no choice.
The South London Healthcare NHS Trust is the most financially challenged in the country, with a deficit of £65 million per annum. It currently spends some £60 million a year, or 16% of its annual income, to service two PFI contracts signed in 1998. For this and other reasons, repeated local attempts to resolve the financial crisis at the Trust have failed. As a result, the Trust is losing more than £1 million every week. In the 3 years since it was formed in 2009, it has generated a deficit of £153 million, a figure that will rise to more than £200 million by the end of this financial year, a huge amount of money that has to be diverted away from frontline patient care.
The Health Secretary, Jeremy Hunt. We can now welcome our viewers in Scotland who've just finished watching First Minister's Questions. A bit late today, just gone 25 to 1, but with us they are. Now, with us from outside Lewisham Hospital is BBC London's Alex Bushell. Alex Bushell, what's the reaction there?
Well, as you'd expect, dismay and disappointment and a great deal of anger as well. They say that this decision to close the A&E unit here, downsizing it to a minor care centre, an urgent care centre it's called, and also to downgrade the maternity unit is grossly unfair. They point to the fact that the South London Healthcare Trust, the Secretary of State was referring to there, is a neighbouring trust. This hospital has debts, but they are manageable, and they don't see why they should be forced to pay for the mismanagement, as they see it, of a neighbouring trust. Now, what it means for the people of Lewisham is very simple. The A&E unit, will go, and in its place, an urgent care centre. That means 120,000 people come through the doors currently. That will drop to 60,000 people. As for the maternity unit, it loses its labour ward, and it will lose capacity as well. 4,500 births every year here at the Lewisham Hospital. That will shrink now to 1,000 births. A great deal of anger here, and the campaigners who we saw last weekend bringing their numbers out in some force, around 20,000 people marching here in Lewisham, say the argument may be lost, but the battle isn't over. They will continue to fight this. They say there are 3 years for the implementation to be carried out, and they'll continue to try and frustrate the Secretary of State, and they'll also be seeking judicial review. They point to the public consultation period, they say, not being long enough. They say this has been smuggled in through the back door, and they're looking for 3 months of public consultation, and that's why they'll be going to the courts to try and overturn this decision.
Alex Bushell, outside Lewisham Hospital, thank you. Well, with us now is Mike Farrar from the NHS Confederation and the Conservative MP Nick Dubois. Welcome to both of you. Can I start with you first of all? What do you say to the reaction there? It's grossly unfair, particularly because Lewisham hasn't mismanaged its finances in the way neighbouring hospitals have, and they're going to fight it.
Well, I think the point is a more general one. Up and down the country we're seeing people thinking about the changes to health services that we need to make. Right at the moment, the way in which hospital care and primary care is organised is we're not getting the best results that we can do for patients, we're not spending the money as wisely as we can, and we need to make a very strong case for change, which accords with public opinion rather than confuses public opinion about why we can get better services that actually will save lives. And if we do that, we would like to think that we could count on the political support from our elected colleagues.
And can you not count on that political support?
I think in many cases we can, but we have seen occasions when politicians have agreed with me in private, for example, when I was running health services, that the case for change was there, but then say, but I do feel I have to be at the front of the march, and I think that's not helpful from a public point of view.
Do you think, actually, you're not being straight with your constituents when in fact, as an MP in an area where a local hospital is proposed for closure because perhaps it's failing or it's not as good as it would be if there was a merger or a bigger hospital with all those units slightly further away, by saying I'm going to campaign to keep it open at any cost?
Well, let's deal with that directly. I was elected to fight and to save Chase Farm A&E from being downgraded, and no one else.
In your constituency?
Yes, I'm sorry, but they've been downgraded, fundamentally because the neighbouring North Mids and Barnet was saddled with ghastly PFI debts. This was a consultation that many people had lost faith in and trust since 2005. So I was elected to do that job, so there's absolutely no question that I should make those representations.
You were elected to do that job. Is it the right decision, though, to back keeping a hospital open if there is a clinical case that clearly says we'd be better off closing this unit and having a larger, more specialist unit up the road.
But the issue is not for a politician to start arguing what the clinical case is. My whole criticism of the debate that's gone on around Chase Farm is that the medical profession did not step up to the mark, did not make the case, from GPs in some cases right through to senior people. If they had done that, they can win the hearts and minds of people if it's the right thing to do.
Well, why aren't they doing that?
I think Nick's right, that we have to win hearts and minds of people, and clinicians really do need to be involved in making those cases much stronger than perhaps we've done in the past. My argument is that where those cases for change have been made, like saving lives around reducing heart attack deaths or improving survival rates from stroke, I think where clinicians are saying that, I would expect my MP to be supportive of that.
Right, would you like local politicians to keep out of the debate altogether?
I'm a Democrat. I believe in democracy. I think it's really important that the people understand why these changes in their interest. They look for political leadership from their MPs. I'd like to join us all up and align that.
Right, but why? I mean, I've got your letter here that you actually wrote to Bruce Keogh, the medical director of the NHS, and saying that actually the frontline professionals just weren't there. They weren't there arguing the case and didn't take the lead. I mean, if they're not there arguing for a hospital to be closed because there is a better alternative, then you can't expect politicians to do it for you.
Well, again, I would accept that, and I think that we have got to step up to the plate, and we have to make the clinical case for change. We have to explain what it means, but we also then need and depend on our politicians to be responsible.
Right, but Nick, what do you think there will ever be a case of MPs standing there saying, I think our local hospital should close? I'm not saying in your constituency particularly, but is there ever going to be a case, even when the clinical case is clear and it's been communicated to people, you're still not going to say, close the hospital?
It would be an extremely foolish MP who stood outside an A&E that no one was going to, or massive reduced number of people were going to and not using, to say, save this A&E. And I think that is an issue, particularly when the government themselves have said that actually, if we don't win the support of GPs and we don't win the support of patients, this is one of the 4 tests. So I think, in a way, you've got this conflict going on between winning the medical argument, which I think is a reasoned argument, and one that needs to be fronted by the medical profession. And only then, I think, should the politicians sort of be making the point about reflecting their constituents' wishes as to what they wish to do. These things don't happen overnight. Chase Farm had been going on since 2005 and still is.
But you can understand constituents are never going to campaign to close their hospital, even if the numbers are low, unless they are persuaded of a clinical argument that needs the backing of their local MP. And if they are told that actually distances to the nearest hospital may be a bit further, but you'll see a specialist and your rate of survival will increase as a result, that's the argument you need to make too.
Well, if the argument is valid, I could see a case for someone doing it. But when you actually have 8 years of consultations that are held behind closed doors in central London, and look at which are remote from the actual people in the constituency. Take a look at my example, the example I'm quoting in Chase Farm. If you say we're going to consult with the majority of people from Barnet, from Haringey and from Enfield, which is exactly the area we're talking about, is it any wonder that there is a majority, which is based on Barnet and Haringey, that says, you know what, we'd rather downgrade Chase Farm and give all the stuff to our neighbouring hospitals, which is now what is happening. So if you're going to have a transparent, open, honest consultation, I think the medical profession have a chance. But I'm not signing up to anything that's been going on in Chase Farm where it's not transparent, it hasn't been fair, and frankly, it's wrong.
Fine. Nick Dubois, Mike Brown, thank you very much.
Thank you.